Hello everybody, I'm Dr. Anil Kamath. I'm a senior consultant surgical oncologist here at Helios Cancer Clinic. So now I will talk to you a little bit about prostate cancer screening. Now prostate cancer screening, what do you mean by screening? Screening is doing tests in a person who doesn't have symptoms. That is, the attempt is to detect the disease much before it would otherwise normally manifest. Prostate cancer, being a slow growing cancer, is quite amenable for screening so that it gives us enough time to do the test and get the result. So what is the test done for prostate cancer screening? The test done is a simple blood test. It is known as PSA, or prostate-specific antigen. It is a protein produced by the prostate, and if the PSA levels are high, there is a possibility that the person could have prostate cancer. What is the cutoff for PSA? Now, PSA can be influenced by many factors. If the person has got a large size prostate, which most of the older people do, the PSA value can be high and it can be fallacious. If there has been a recent urinary infection or a prostatic infection, the PSA value can be high. So there is no strict cutoff range, but generally most people take something around 4 nanogram per ml, something more than that, as something which should be investigated a little further. I must also warn that PSA is not a specific test. Just because PSA value is high, it doesn't mean that a person has prostate cancer. In fact, most of the time, the person will not have prostate cancer. So PSA should just be taken as something which requires more investigation. It should not be taken as that the person has got prostate cancer. And like I said, there can be many reasons why PSA test can go up. Should everybody get the PSA test done? Broadly, the test will not suit everybody. If you're too young, there is no value, say below 40 years, and the risk of prostate cancer is low, there is no value in doing this test. Similarly, old people who have less than a 10-year survival possibility rate have less value in doing this PSA test. Normally, the people who get most benefit are those who are in the 50 to 60 range, who have got some increased chance of getting prostate cancer, and who have got, if detected early and treated properly, have got a high likelihood of long survival. PSA test helps detect cancer in an early stage. So it has happened that a normal person has got the test done, the value has turned out to be high, and then when we investigate, we find that the person actually has got a prostate cancer which requires treatment. So it has helped save people's lives. But at the same time, it has got its downsides also. Like I said, it's not a specific test. There are many conditions in which the PSA can go up. Most of the time, there are a lot of doctors who believe that it only detects cancers which otherwise would not have manifest in the person's lifetime. Very slow growing tests, and this leads to unnecessary intervention and also unnecessary procedures. So the PSA test has its drawbacks and should be used with caution. And the results should be interpreted by trained personnel only. And for normal public, if the PSA value does turn out to be high during the annual examination, there is nothing to be worried about, because most of the time this is not cancer, but it should raise some alarm bells to investigate further. PSA is usually combined with a digital rectal examination where the doctor examines the prostate through the rectum with a gloved finger. And if there is real suspicion that this could be prostate cancer, we don't rely only on PSA, we do higher investigations like probably a MRI of the prostate. And the final confirmation of the cancer comes through a biopsy. So PSA is just a screening tool. It just helps us to detect the possibility of prostate cancer. And it should be interpreted by trained medical personnel only. Thank you.